I got asked to do a panel early on in COVID, in the COVID pandemic. I remember the title was COVID-19 Doesn't Discriminate. And what I did was say, I'm not going to be on the panel unless you change that name, because that's not true. Any virus, and I, grew up as a journalist studying and reporting about HIV/AIDS. It's also a virus. So many of the same people were studying kind of viruses and those kinds of diseases. So all of us were sort of like, when COVID happens, like, oh no, this is going to discriminate. These kinds of diseases, infectious diseases, do discriminate against people who are the most marginalized. So the ones that weren't on Zoom at work, but actually out working in communities that didn't get testing right away and definitely didn't get the vaccine right away. Also, who were harmed by the system, the healthcare system already. And then that meant that they don't maybe believe in the healthcare system, are afraid of it, have been hurt by it, and then don't want to get tested or vaccinated because of fear. And fear that makes sense because of hurt that has happened to them. And so right away, many of us were, when it was sort of, oh yeah, COVID doesn't discriminate, it was, yes, it does. And people under the radar, even I remember it was like 2020 in March when I started thinking about this and writing about it early on. There were underground conversations of Black people in public health and other people of color that were saying, this is going to be a huge problem for Black people. And it ended up being that way. The other problem was the intersection of environmental racism. So in places that were already polluted, this was a problem of the lungs. If your lungs were damaged because you lived near an incinerator, you live near a refinery, the air isn't good in your community, then you're going to have worse COVID hospitalization and higher death rates. And that happened right away in Cancer Alley. I remember the study came out, it was April 2020, and it made the intentional link about people who live in communities where the air is bad have worse COVID outcomes. And then, I just thought, oh no, this is, again, Black people who are so much more likely to live in communities where the air isn't clean.